In the world of science, there is no higher honor than the Nobel Prize. It is the gold standard of human achievement, awarded to those who have conferred the greatest benefit to humankind. We associate it with the discovery of penicillin, the structure of DNA, and the fight against deadly viruses. But in 1949, the Nobel Assembly gave this prestigious award to a Portuguese neurologist named António Egas Moniz. His contribution to medicine wasn't a cure for cancer. It wasn't a vaccine. His invention was a procedure that involved drilling holes into a human skull and blindly swishing a metal spatula through the most sensitive part of the brain. It was hailed as a miracle, a great and desperate cure. We call it the lobotomy. And while history remembers it as a barbaric nightmare, for one American family, the most powerful family in the country, it wasn't history. It was a Tuesday morning. This is the story of how modern medicine stole the soul of a Kennedy and how the world applauded the men who held the knife. To understand how something this horrific happens, you have to understand the time period. The year is 1935. There is no Prozac. There is no Xanax. There are no antipsychotics. If you suffered from schizophrenia, severe anxiety, or manic depression, your future was a brick building with barred windows. Asylums were overflowing. Doctors were desperate. Enter António Egas Moniz. In 1935, he pioneered a procedure he called the prefrontal leucotomy. His theory was dangerously simple. He believed that mental illness was caused by fixed circuits in the brain nerves that were stuck in a loop of obsessive, overwhelming emotion. The theory went like this. The thalamus is the emotional center of the brain. The prefrontal cortex is the thinking center. If the wires connecting them are carrying too much emotional voltage, why not just cut the wires? Moniz performed the first surgery in 1935. But the procedure didn't stay in Europe. It crossed the Atlantic and landed in the hands of two ambitious Americans, Dr. Walter Freeman and Dr. James Watts. Freeman was the showman. Watts was the surgeon. Together, they adapted Moniz's technique into what became the standard prefrontal lobotomy. Their first operation was in 1936. They claimed they could stabilize personality. They claimed they could cure the incurable. The medical community was divided, but the public was fascinated. For families burdened by a mentally ill relative, Freeman offered hope. But hope, in the hands of the ambitious, can be a dangerous weapon. This brings us to the Kennedys. Joseph P. Kennedy, the patriarch, was a man obsessed with perfection. His children were destined for greatness: presidencies, ambassadorships, legacy, but his eldest daughter, Rosemary, was different. Rosemary was beautiful and socially active, but she struggled with learning disabilities and erratic mood swings. As she entered her early 20s, her behavior became more rebellious. She would sneak out at night. She had violent tantrums. For a family building a political dynasty, Rosemary was seen as a liability. Joseph Kennedy sought a solution. He found Dr. Walter Freeman. Despite the hesitation of Rosemary's siblings and mother, Joseph authorized the procedure. He was told it would calm her down. He was told it would make her docile. He had no idea that he was signing a death warrant for his daughter's consciousness. It is November 1941. Rosemary Kennedy is 23 years old. She is brought to the George Washington University Hospital. Now, I want you to erase everything you think you know about brain surgery. There is no general anesthesia here. There is no putting the patient to sleep. The brain itself has no pain receptors. It cannot feel the cut. So, the doctors administer a local anesthetic, Novocaine, just for the scalp. Rosemary is strapped to the operating table. She is fully awake. She is terrified, but she trusts the doctors. She trusts her father. Dr. James Watts begins. He makes an incision on one side of her forehead, 3 centimeters behind the eye. Then, the drilling begins. A burr hole, roughly the size of a dime, is bored through the skull bone. Then, he moves to the other side and does it again. Imagine the sound. The high-pitched whine of the drill reverberating through your own skull. The smell of friction and bone dust, acrid and chalky, filling your nose. Rosemary lies there, feeling the pressure, hearing the crunch, unable to move. Once the holes are open, Dr. Watts inserts the leucotome. It looks like an ice pick or a thin spatula. He pushes it through the hole, deep into the frontal lobe of Rosemary's brain. And this is where the procedure becomes a true psychological horror. Because they couldn't see what they were cutting, Dr. Freeman needed a way to gauge how much brain tissue to destroy. He needed a guide. That guide was Rosemary's voice. Dr. Freeman crouched by Rosemary's face. He asked her questions. He told her to sing. Rosemary, recite the Lord's Prayer. Rosemary, sing God Bless America. Rosemary, count backward from 10. While she sang, Dr. Watts swept the metal instrument back and forth inside her skull. He was severing the white matter, the association tracks that allow us to process emotion, personality, and speech. They cut, she sang. They cut deeper, she faltered. Freeman would make notes. She is still making sense, cut more. Watts adjusted the angle. He pushed the instrument further into the healthy tissue. Rosemary began to become incoherent. Her sentences fragmented. The songs turned into mumbles. But Freeman wasn't satisfied yet. The anxiety might still be there. The turning point came when the instrument made its final sweep. Dr. Watts later recalled the specific sensation of the spatula cutting through brain tissue, a resistance, then a release. Rosemary stopped speaking. She stopped counting. The light in her eyes, the spark of the 2-3-year-old woman she was, vanished. She became silent. Only then did Dr. Watts withdraw the instrument. The procedure was declared a success. The agitation was gone. But so was Rosemary. The tragedy was immediate. When the swelling went down, it was clear that something catastrophic had occurred. Rosemary Kennedy did not wake up stabilized. She woke up broken. She had regressed to the mental capacity of a 2-year-old child. She could no longer speak articulately. She could only babble. She had lost control of her bodily functions. She suffered from hemiplegia paralysis on one side of her body and would walk with a limp for the rest of her life. The vibrant young woman who had danced at parties and dined with diplomats was gone. In her place was an invalid who required 24-hour care. Joseph Kennedy, realizing the magnitude of his mistake, did what many powerful men do. He hid it. Rosemary was secretly institutionalized. She was sent to Street Coletta's School for Exceptional Children in Wisconsin. She remained there, hidden from the public and largely isolated from her family, for the next 63 years. While Rosemary languished in silence, the lobotomy craze continued. Dr. Walter Freeman became even more aggressive. He developed the transorbital lobotomy, the infamous ice pick method, where he would hammer a tool through the patient's eye socket. He traveled the country in a van he called the Lobotomobile, performing surgeries in hotel rooms and psychiatric wards, often without sterile technique. It wasn't until the mid-1950 seconds that the horror finally began to end. The introduction of chlorpromazine, or thorazine, provided a chemical alternative to the knife. Doctors realized they could treat symptoms without destroying the brain. The popularity of the lobotomy plummeted. Dr. James Watts, the man who held the knife inside Rosemary's head, later expressed deep regret about her specific case. He knew they had gone too far. Dr. Freeman, however, never apologized. He continued until 1967, when he was finally stripped of his hospital privileges after a patient died on his table. But what about the man who started it all? António Egas Moniz. Despite the thousands of lives ruined, the personalities erased, and the barbaric nature of the procedure, Egas Moniz was never stripped of his honor. To this day, the 1,949 Nobel Prize in Physiology or Medicine remains assigned to him for his discovery of the therapeutic value of leucotomy in certain psychoses. Rosemary Kennedy died in 2005 at the age of 86. She lived a long life, but her life effectively ended in November 1941 on a table, singing God Bless America until the words were cut out of her. Her story serves as a chilling reminder. Science is a tool, but it is wielded by humans. And sometimes, in the pursuit of a cure, we create a monster. The lobotomy is now obsolete, banned, and viewed with horror. But the Nobel Prize remains a golden testament to a time when we thought the best way to heal the mind was to destroy it.